My name's Jordan Toms and I was diagnosed with an oligodendroglioma, which is a brain tumour, at 22 in my final year at university. My treatment was I had a surgery which was a craniotomy and then had radiotherapy for about a month and a half and then chemotherapy for a year.
My name is Anna Crofton. I'm a Neuro-oncology advanced nurse practitioner. If you've had treatment for a brain tumour such as surgery, radiotherapy or chemotherapy, there may be some longer term changes that you may see over time. Longer term changes are not immediate side effects of treatment, but are changes that can happen over a period of time that affect day-to-day living. These can sometimes improve over time and with help, or they may remain permanent. Tiredness is common and can affect the simplest of tasks, such as hanging out the washing or walking the dog. Changes can include problems with mobility, and this can be as a result of problems with balance, coordination, or a weakness in the arm or the leg. The way that you think may be affected, and this can include concentration, memory, mood and personality may be affected. You may feel more sensitive in certain situations, and also your family may pick up on subtle changes in certain situations. Speech can sometimes be affected. This may be forming the right words or understanding what is being said to you. Changes to your appearance can include scars, hair loss, or weight gain or loss. This can affect your body image and how you feel about your body.
After the surgery, my side effects was left-sided weakness, which I struggled to walk or get out of the bed, talk and explain how I was feeling, and I couldn't really use my left arm, so normal daily tasks became quite difficult. For example, like brushing your teeth or using cutlery to eat dinner. My speech was affected, so talking to people or going out to the shops or buying something was quite hard. So after the surgery I felt quite down because I couldn't use my left arm properly. I was quite an active person before, and sort of when I struggled to talk and explain how I was feeling, I just kept everything bottled up. I tried to avoid talking because it made me upset. After I lost my hair, which showed my scar off a bit more, I felt quite self-conscious about it, but I think you shouldn't be ashamed of what the situation you're in.
Your clinical nurse specialist will be able to provide you with emotional and psychological support, as well as referring you to the most appropriate healthcare professional to provide practical support. These may include an occupational therapist, who will be able to help with memory problems, tiredness, practical problems such as washing and dressing and cooking and cleaning. A physiotherapist may help with mobility problems and moving around, and a speech and language therapist may help with speech difficulties and swallowing difficulties.
I saw a guy who did a few cognitive tests about memory, speed of processing, maths, and then just to work out what was not quite the same as before. I worked with a speech therapist on a weekly basis, so we read stories, read out long words, new words which I couldn't remember or think to say. So if I struggled with them, I just repeat it and eventually get it. I saw a physiotherapist about my hand because I felt it wasn't improving as fast as the rest of my arm. So she suggested a hand grip, which you can increase the tension to improve the dexterity of my fingers. Long-term effects, my left hand's still a bit slow, but it's manageable. I can brush my teeth now, use cutlery properly, and all the strength is back.
If things change, or you have things that you're worried about, you can contact your GP or clinical nurse specialist.
Throughout my cancer journey, the support through my family has been really strong. My two brothers really helped me to get out of the house, go to the gym with them and get my left arm training. After my treatment, I went travelling for a month to Australia, and then this year I got a part-time job. Now it's been about 2.5 years since my diagnosis. I feel very comfortable. I feel more outgoing, more confident because I've been through the treatment. I've been through the hard times and got out of it. The advice I give someone who got diagnosed with a brain tumour: find someone to talk to, discuss the things you're worried about or what you're going through and explain to them, and it'll help you compute what you're going through.